Welcome to The Functional Edge. I'm Dr. Julia Ward, and this is where science meets real-world strategies for living healthier, sharper, and stronger. From uncovering hidden environmental toxins to unlocking peak performance and mental clarity, we cover it all. Ready to take control of your health and thrive? Let's dive in. Welcome to the Functional Edge podcast. I'm your host, Dr. Julia Ward, Medical Director and founder of Balanced Body Functional Medicine. Today, we're honored to welcome Dr. Monica Jauregui to our show. In this episode, Dr. Jauregui will be sharing insights on mold and mycotoxin illness and offering expert guidance to help you navigate your health journey with the latest advancements in functional medicine. Stay tuned for an engaging conversation that promises to empower and inspire your path to wellness. So, Dr. Monica, please just give us a little introduction about yourself, and then we'll launch into some questions.
Absolutely. Well, thank you so much for having me on your podcast. It's nice to be here and inform people about this super important topic. So I, like you, I'm a medical doctor. And I trained conventionally first, went to medical school, then got my degree from LSU in internal medicine. That's my specialization. I worked in the hospitals, ICUs for about a decade, and then I decided to do something different with my career. I pivoted, went into the whole integrative space. As I was doing that, my family started getting sick, and we couldn't figure out why my family was getting sick. And so that is when we found out that my house had this big leak, and we had some mold growing, had some mold toxicity. And so I learned from personal experience about this whole mold journey. So that's one of the main things that people seek me out for, is for treatment for mold toxicity. I also treat people for a lot of chronic complex issues, chronic infections like Lyme disease. A lot of times I'll get people that say, I've seen 10, 15 doctors, nobody's been able to figure it out. So that's what I'm coming to you for. And so that's what my practice is mostly based on. My practice name is Truly Healthy MD. I am in the Dallas area, do mostly telehealth. I can see anybody in all of Texas because I do telehealth. I'm licensed in all of Texas, and I also want to educate the world and about these things. So on my website, there's some educational things that even if you can't be my patient because you don't live in Texas, you can definitely go to my website, which is trulyhealthymd.com, and I have some educational resources for people to learn about these things.
Wonderful, wonderful. Thank you. Well, let's just sort of jump right in. Spotting the signs of mold. So mold illness can often fly under the radar or be mistaken for something else. So what are early indicators or patient experiences? What experiences typically prompt patients to consider mold as an underlying cause?
Yeah, that's a great question, because there's a lot of people out there with mold toxicity, and they just don't know that this is the reason for their symptoms. Uh, in part because there is just not enough awareness in our community, and because mainstream physicians haven't really adopted, they haven't read the latest research about this, so they don't know that this is a problem that is, it's a big problem. So it's important for people to be aware that this may be a problem. This is not something that most doctors will be literate in. You will have to definitely find a physician who has done some extra training and understands this. The best way to find a physician is by going to, for example, the doctor that I trained under is Dr. Neil Nathan. If you go to his website, it lists all the doctors that he's trained. And that's a good place to find a doctor that is literate in mold toxicity, because you go to your primary care doctor or somebody in conventional medicine, you say you might have a mold issue, and they're like, well, do you have allergy to mold? Do you have a fungus ball? Aspergillus is growing in your lungs? And those are the only things they recognize as far as how mold can affect our body. But
Hmm.
we now know, and this is pretty cutting edge, it's only been described in the last decade or so, that mold can affect our body in other ways. That's not just the allergies that we know about, or the invasive type of fungal infection, right? That, you know, a fungal ball in the sinus cavity or in the lungs. There's another way in which mold can affect our bodies, and it's because molds, they put out into the environment what we call mycotoxins. And so these are things like ochratoxin, zearalenone, trichothecene. I know these are kind of complicated words. There's not going to be a test, but what these toxins are is that's the way that molds kill off other molds. So they're made to be toxic. They're made to kill other molds.
Yeah, yeah,
So that the mold can grow. And it's, if you think of a petri dish, right? Like all the little mold colonies are kind of like invading each other. So they're each putting off these mold toxins to try to kill off the other molds. Unfortunately, when us as humans, when we're exposed to these same mycotoxins
hmm
in large concentrations, they can also affect the human body. These mycotoxins are very, 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 very small. They're not the spores, which are a little bit larger. They're very, very, very small. We think that the main ways that people are exposed to them are through the respiratory tract. People
hmm
who live in water damaged buildings mostly. But you know, sometimes people are exposed in their car if their car has a mold issue in the vents. There's different places where people can be exposed to these. Um, let's say you're living in a water damaged building that has a lot of mold. Even if you can't see it, it might just be behind the drywall. It's releasing these toxins, trying to
yeah,
exert its dominance right into space. And so you might be inhaling these things. They're very, very small particles, and they're what we call in medicine lipophilic, which means that they uh, blend in very well with our tissues. They can get into all our tissues. They can get into our brain, into our kidneys, into our liver, definitely into our bloodstream. All of this, to answer your question, is what are the symptoms? The symptoms
hmm
can be just about anything, which makes it so hard for us to diagnose. It's not like it's just one or two common symptoms that we see, and
right,
patient walks in with headaches, that's mold toxicity, or patient walks in with XYZ, that's mold toxicity. No,
yeah,
it can present with a lot of things. The main things that trigger, in my mind, the need to get a mycotoxin test in my patients typically are things, chronic issues, fatigue, weakness, suppressed immune system, things that cannot be explained with conventional labs. Most of these
hmm
patients, their labs look completely normal. Uh,
hmm
they might have very severe symptoms and they might do a brain scan on them. The brain scan looks completely normal. And
yeah,
so a lot of these people are very frustrated because they have very severe symptoms and they are going to doctors trying to find explanations. Their doctors are also frustrated because they're like, I don't know. Your
right,
blood work sure looks good.
yeah,
Your
yeah,
scans look good. I don't know. Maybe you're depressed, or maybe,
yeah, yeah,
doctors are definitely trying to help, but sometimes they just don't have the answers if they're not aware of this.
yeah,
Um,
yeah.
and so, uh,
Yeah, I
another,
find it interesting too that mold can affect people in different ways. And so even in the same household, one person can be more severely affected than another. Why is that?
yeah, and that's something that we see a lot because um, we're all genetically predisposed to one retain mycotoxins more. Some people are better at excreting
Hmm
mycotoxins than
hmm
others. It also has a lot to do with how healthy your gut is.
hmm
If you are eating something that has some mycotoxins in it and
Yeah.
your gut is super robust, you have absolutely no increased intestinal permeability, what people call leaky gut,
hmm
then those mycotoxins, you might eat something that has some mold toxins in it and you're just going to poop it out, right? But if you have a lot of leaky gut, if you're, drinking a lot of alcohol, or for some reason your gut is impaired, you're just going to
Mhm.
absorb them super fast. And
Yeah.
so, husband and wife might be living in the same household and exposed to the same things, and one may be extremely sick and the other may have absolutely no symptoms because of those different factors. Uh,
Yeah. Yeah. So, what specific tests or diagnostic methods have you found most effective in uncovering mold toxicity, and how do these results shape your treatment strategy?
So again, this is very cutting edge stuff. We don't have a lot of studies yet.
Hmm.
We're in the process of getting some more studies. Dr. Jill Krista, Dr. Neil Nathan are some of the doctors that are leading up these studies. But up till now, uh, what we know because of clinical experience mostly is that we can find these in the urine. That is the main way that we detect these. So when I suspect that a patient has this problem, what I'll ask them to do is to purchase a test where we check urinary mycotoxins. And that test will tell you the concentration of these toxins. And so the way that's reported is there's like this line in the middle. And so if the concentration is below that line, it just means that you're exposed, but it's not in sufficient concentration to be causing a symptom in you. But if it's above that line, then you have sufficient concentration where it's likely to be causing one of your symptoms. So it's a very easy test, and that's good because we also like to repeat these tests. We like to know that those levels are coming down when we implement treatments.
Yeah, got it. So when treating patients with mold toxicity, whether dealing with acute flare-ups or chronic cases, what are the key initial steps or principles that guide your approach?
So, number one is we need to assess whether the patient is still being exposed. Sometimes we have patients that were exposed in the past and they just never excreted them. And then we can just go ahead and treat them. But in those people who are actively exposed, there's no point in trying to treat them if they're just going to uh, live in that same environment and build up
Right.
those toxins, get some out, but then pour a ton in, right? So number
Yeah,
one is determine if they're living in a situation that continues to have them exposed.
right.
Number two is that we help the body eliminate them. So the way that we help the body eliminate them is through the gut. We use what we call binders. So just like if you go to the ER, if a person goes to the ER because they overdosed on a medication, they will give them activated charcoal to bind that medication and poop it out.
Hmm.
We use that same principle with these mycotoxins. These mycotoxins, they circulate, they're in our blood, they're in our gut. When they're in our gut, we can use activated charcoal and other binders to help the body eliminate them. Um, Other ways to help us eliminate them is all the things that help us remove toxins. You have to stay hydrated, make sure you're peeing enough. Yeah, if you can use a sauna, that's a great way to help eliminate them. But the mainstay of therapy is helping the gut uh,
Hmm.
and bind them so that they come out when people have bowel movements.
That's great. So, how do you help patients kind of pinpoint if there's a mold problem at home, at work, in their car? Like, what do you advise them to do?
And that's definitely, like we said, that has to be step number one. And
Mhm.
unfortunately, that's a very complex problem because uh, when we get into situations where people need to either have a home remediation, which can be very expensive, or move,
Mhm.
that's a life-changing event, correct? And
Yeah.
so it's a very difficult thing to deal with. It's important, and every situation is going to be unique. The best thing that people can do is to get in contact with a specialist. Just like my specialty is the human body and healing it, there are other people whose specialty is homes and they're called Indoor Environmental Professionals, IEPs. They can be found, one of the best websites, it's called ISEAI.org, the International Society for Environmentally Acquired, ISEAI. Anyway, forgot what the last
Yeah.
I is. Anyway,
Yeah.
and those IEPs, indoor environmental specialists, are the best people to guide you in how to go about figuring out if you're actively exposed, and if you are, what the steps are to get that solved.
Yeah, that sounds great. There are like plates that you can get on Amazon or something, like they look like petri dishes that you can put out in the room just to get a general sense. But I understand it's not nearly as thorough as getting an actual mold inspector in. So
Yeah, and so there are some petri dishes. If you want to do a test that doesn't involve getting a specialist involved, there are some methods. I would not specifically recommend those petri dishes. What we do recommend sometimes is doing what's called an EMA test or an ERMI test, where you purchase this kit online through specific labs that run these things, and then you collect samples around your home, you mail those samples in, and then
mhm,
they do this test. And that's been a lot more validated than the petri dishes per se.
that's good to know. Yeah, good to know because it's nice to have alternatives if somebody can't afford to get an actual
Hmm.
mold inspector in.
Absolutely.
Yeah. So, as far as the gut connection, recognizing that mold exposure can significantly affect gut health, how do you integrate gut healing protocols into your overall treatment plans?
Yeah, that's an excellent question. Um, when we want to treat people from a holistic and integrative approach, we do start thinking about the gut first. We start thinking about how can we heal the gut, and mold is no exception to that. So there's several ways in which mycotoxins affect the gut, and gut health affect mycotoxins. So we already talked about the fact that when your gut is leaky, when it has increased permeability, you're going to
Mhm.
be absorbing more of these mycotoxins. That's one thing. But it's also true that when people come in and they have multiple GI symptoms, they might be having, what we call in conventional medicine as irritable bowel syndrome, which really doesn't mean anything. It just means, I don't know
Yeah.
what's going on with your gut.
Yeah.
It could be a lot of things. It could be what we call SIBO, small
Mhm.
intestinal bacterial overgrowth. It could be dysbiosis, an imbalance in the bacteria. It could be SIFO, small intestinal fungal overgrowth. Ton of things that can happen to explain what's called IBS. A lot of these things will not get better if a patient has a concurrent mycotoxin problem. So these mycotoxins go in there and they alter the normal way that the gut functions. You're not going to have normal emptying of the small intestine into the large intestine, so stuff stagnates. It goes in there and it will kill off some of the good bacteria. So you're going to have some overgrowth of the bad bacteria. And so making sure that if you have a gut symptom, and you're potentially going to a conventional doctor or an integrative doctor or a naturopath, if you're not getting results, looking to see if mycotoxins are the root cause of
Mhm.
that big problem is probably a good idea. May or may not
Yeah.
be, but I see that very often where people say, I've been through 10 different gut healing protocols. I've done them all. I've taken all the supplements or the medications. My GI doctor can't figure out what's wrong, my naturopath. And then come to find out that it was the fact that they hadn't addressed the mycotoxins. If mycotoxins are present, it's very hard for us to restore normal gut function, and people
Yeah.
tend to be extremely symptomatic.
Right. Right. So chronic inflammation is a common challenge in mold toxicity cases. What strategies do you rely on to help your patients combat and reduce this inflammation?
Yeah, absolutely. And people come in with these inflammatory uh, complaints as one of the main symptoms, right?
Mhm.
They're like, my
Yeah.
joints hurt, my
Mhm.
muscles hurt. A lot of what's called fibromyalgia in conventional
Mhm.
medicine probably is mold toxicity. We just don't
Yeah.
know because not enough people are being tested, right? Those that
Right.
are being tested and treated in integrative doctor's offices, we do find that they are due to mold. So
Yeah.
yes, the inflammatory aspect is one of the most bothersome parts of having mold toxicity. So addressing that immediately is super important. So those symptoms are not going to go away completely until the mycotoxins are out of the body, but before we get the mycotoxins out, there's a lot of things that we can do to start calming down the inflammation. Some of that are just eating a diet that's an anti-inflammatory diet, and
Mhm.
that would be everything that's rich in phytonutrients, fruit, vegetables, things that are very synergistic with our body to decrease inflammation instead of, thinking I'll have pizza, hamburger, try to eat foods that are whole and nutritious. There are some very targeted supplements that we can use at times, like curcumin and that type of stuff, also to target that inflammation. And another thing is that when we have a lot of mycotoxins in our body, they activate what we call mast cells. So mast cells are part of our immune system. They live in a lot of our different organs. Think about all the organs that are exposed to the outside. So like the lining of the lungs, right? If you breathe in and you start wheezing, you have something similar to an asthma attack, it's because the mast cells are degranulating. They're letting go of all this histamine. The more mycotoxins you have, the more mast cells are going to be super active. And also, they're in the gut, they're in the brain. We have a lot of ways where we can calm down the mast cells. Some things are antihistamines, the same antihistamine you would take for um, when you have allergies. We use those also to stabilize the mast cells, tell the mast cells it's okay, you don't have to be releasing all your histamine all the time. And there's also more advanced medications. One's called cromolyn that stabilizes the mast cells. And once those mast cells aren't releasing histamine and other inflammatory mediators all the time, people feel a lot better, a lot faster. We
Mm.
always, want to get to the point where they won't have to depend on taking these medications to feel better, but acutely, we can really control the inflammation a lot more quickly.
That's great. That's great. Sounds like diet really makes a big difference too in how people are feeling day to
Hmm.
day.
Oh yeah, absolutely. We have to start with what people are eating. There's no way to heal if you're not taking that into account first. And it's not just diet. It's also um, uh, other things like all the foundational things.
So, educating patients is crucial to prevent re-exposure and long-term recovery. How do you approach this education and what lifestyle changes do you emphasize?
Yes, that's very important because a lot of these patients are just really exhausted by the time they reach me. They feel like they haven't been heard, that people don't understand them, and so they do tend to already be a little bit depressed from that standpoint, or have difficulty coping with their emotions. But on top of that, mycotoxins also uh, get into our brain, and they can affect our emotions. They start affecting the part of our brain that's called the limbic system. And
Hmm.
so the limbic system is the part of our brain that regulates emotion. And to the extent that even if people heal from mycotoxins, if we don't address the damage that was done to the limbic system, they can continue to have a lot of emotional problems. Even, mycotoxins are completely gone, but their emotions can still be very affected. And
Right.
so it's very, very important that patients recognize that it's not that that everything's in their head. It's that
Hmm.
the mycotoxins did some real damage. It's like termites. If a building has termites, you don't just go and kill the termites. You have to go and replace the pieces of wood that were eaten up by the termites. The termites might be gone, but if your building is still damaged, then
Yeah.
you still have a problem, right? And so, same thing with the brain. The brain gets damaged by the mycotoxins. People usually do have to address that with what we call limbic system retraining. And yes, the brain can heal, but it doesn't heal from the binders that we do. It
Yeah.
heals by retraining it and letting the limbic system know that it's safe, that the limbic system's there to keep us safe, right? And
Mhm.
so it doesn't know how to turn that switch from on to off until we put people into these limbic training processes.
That's awesome. Do you have the names of some of these limbic retraining programs?
Mhm. Absolutely, yes. And these are great tools for people that have any kind of issues that need to address their emotional
Yeah.
imbalances. It's not just people with mycotoxins.
Yeah.
These things can help you, even if you don't know why you feel down. Um,
Yeah.
they can definitely help people. So the first person to start putting together these problems was Annie Hopper. Her program is called DNRS. And so this is one of the programs that people know most about.
Hmm.
But after Annie Hopper, there's been some other people who have put together some programs that I also like to inform patients about, because everybody's different, and some people might find one program suits them more than another. So
Yeah.
DNRS was the original, and it's still there, still helps a lot of people. But I do encourage my patients to look at the other programs. Another one is the Gupta program.
Hmm.
That also helps a lot of my patients. Another one is Primal Trust.
Hmm.
That one has been one of the ones that I think has been giving my patients the best outcomes lately. This is ever
Yeah.
evolving, so I can't really pick a
Yeah.
favorite,
Yeah.
but I'm just saying,
Absolutely.
like, lately that's been great. I do have a lot of patients who benefit from integrating limbic retraining with their Christian beliefs. There's one called Christian Brain Rewire that uh, patients like if they feel that they would
Hmm.
benefit from having an approach that also acknowledges their Christian beliefs.
Yeah. Great. That's great. So what have been some of the toughest challenges in treating mold toxicity, and what innovative approaches have you developed to overcome these obstacles?
Yes, so patients with mycotoxins can be extremely challenging to treat because they typically, at least when they come to me, they are very sick. I'm sure there's a lot of people out there that have mild mycotoxin illness, but it may not be recognized. By the time they come to me, they typically have been sick for a long time. They may have spent a ton of money trying to get better, so they're already exhausted financially and emotionally in every way.
Mm.
Sometimes they have lost a lot of their friends. It's a very isolating disease too, because they just hadn't had an explanation to why they feel so bad, and they're
Mm.
have a hard time continuing with their social relationships. So these patients are extremely challenging to treat sometimes. So it's very important for me to have a very structured way to help these patients. And so I have to definitely depend on a team of people. I do make sure that my patients are working with a qualified health coach. When I say health coach, some people don't recognize what I mean by that. They're like, oh, well, anybody could be a health coach, right? You just go online and get a little certificate. The health coaches that work with me are health coaches that are trained in integrative medicine and also know about mycotoxins and what they do. And it goes beyond just teaching them how to eat a little bit better. It's a very personalized and holistic view as far as how to help people. So that's the first step. I have to rely on other people. That's not just me. I
Mhm.
cannot help these people by myself. It has to be a team of us. So definitely making sure that they're plugged in with the right health coach, with the right indoor environmental specialist, with the right limbic retraining program. That's the first part. Um, the next part is making sure that it's an individualized approach. People will say, well, what's your protocol? And I'm like, there's no protocols. Every person's different. Every person uh, has to be, we have to tailor these approaches to how each person is individually. A program might work super well for one person, and then it won't work at all for the second if I'm not tuned into exactly uh, the specific patient's circumstances, who they are, what they can and can't manage. Sometimes I will have to put the treatment of mycotoxins on hold until they acknowledge a different part of their health that they need to heal first, and then we'd go to the mold. So
Right.
knowing the person and working around that is the best way that I can support my patients in all of that.
Oh, that sounds great. So can you share some memorable success stories that have, kind of highlighted some of these innovative protocols that you use?
Yeah, absolutely. So I'm lucky to say that I've had a lot of patients who have healed from treating their mycotoxin illness. And that's to me amazing. It helps me come back to work every day, even though my patients can be challenging. So yes, I love celebrating those wins. I would say one case that I'll always hold very dearly to very close to my heart is a young patient. He was 16 when he started seeing me. I don't see a lot of young people. I'm an internist. I tend to see more older groups. So um, I do see a few teenagers. 16-year-old parents brought him in because he had a sudden change in health,
Mhm.
and he from one day to the next he developed ADHD, and they were telling him that, well, he has sudden onset autism at age 16.
Wow.
Just some weird stuff that I'm like, that just doesn't make sense. There has to be a reason. He was developing a lot of anxiety, had to be hospitalized. They tried a lot of things in the hospital. Basically, he was discharged from the hospital. They told him, well, your son has to be on large doses of psychiatric medications the rest of his life. And
Wow.
he was completely healthy a year ago. He was really had a bright future, and now too bad that something happened, right? And
Right.
so these wonderful parents didn't give up. They kept looking for more and more answers.
Mhm.
And when they came to me, we talked about their living situation, and they did tell me that they were living in a home that had some water damage. And so this was a few years back, early in my career as far as treating mycotoxins. It wasn't really on my radar as much. So I was like, huh, that's interesting. So let's use that as a clue. And so yeah,
Yeah.
ordered a mycotoxin test, came back super high levels. I think back then it was one of my first cases. I didn't even recognize how high the levels are, how high they were. Now I look back, I'm like, oh wow, those were really high levels. And yeah, I was new at this, so I had to get a lot of help from my colleagues. I mentioned Dr. Neil Nathan. He's been one of my mentors. Discussed the case in a group of physicians with him, and they helped me get a treatment plan. First thing we did is I told the family, you probably have to find somewhere else to live, and they did. And put him on these binders, and he made a full recovery. And so he went from the first time I saw him, he was nonverbal. He was on a lot of psychiatric medication. If not, he would get really aggressive. And within a few months, he had completely recovered. And that was, to me, a sign that I needed to continue to do this and continue to look for other cases in which I might help people. Now, he was definitely an exception. I will tell you, most people take a lot longer to heal, but that case just really stands out because it was just so obvious. That was the reason, and he made a full recovery, and so that was amazing.
Yeah, that's amazing. And that really seems to highlight a lot of mold cases where like one person in the family is severely affected and then others, maybe a little bit, but not to that degree.
Yeah. Well,
So
and the other thing is that sometimes everybody's affected, but it affects them in a different way.
yeah,
After the family moved, the mother's hormone problems got better. She was in perimenopause, and
yeah,
she actually all her hormone problems got better. And the dad, he was having issues where he kept getting sick and was on all these antibiotics all the time. And after they moved, he was no longer having to take many antibiotics. So
wow.
maybe it is affecting everybody. It just affects
Yeah,
people in a different way.
different way. Yeah, that's awesome. Well, thank you so much for all of this information. It's been really informative. And we'll put a link to your website on the podcast too, so people can check
Awesome.
that out.
I appreciate it. It was
Yeah,
great speaking with you.
thank you so much. We really appreciate having you. It was great.
Bye.
Thank you for joining me on The Functional Edge. I hope today's episode gave you fresh insights and practical tools to level up your life. If you found value in what you heard, don't forget to hit subscribe, share the podcast with someone who needs it, and leave a review. It's the best way to support our mission of bringing powerful health solutions to more people. For more resources, updates, and behind-the-scenes content, visit drjuliaward.com. Until next time, stay strong, stay healthy, and keep living on the functional edge.